Lindsay's nerve in chronic kidney disease. Definition: Chronic kidney disease (CKD), also known as chronic renal disease, is a progressive loss in renal function over a period of months or years. The symptoms of worsening kidney function are not specific and may include feeling general unwell and experiencing a reduced appetite.
Chronic kidney disease, or CKD, describes the gradual loss of kidney function. The primary function of your kidneys is to filter your blood, to remove waste and water. However, over time, conditions like diabetes, high blood pressure, or even other diseases like autoimmune and congenital can damage the kidneys and weaken their ability to filter waste and water from your blood. Now, depending on the disease that is causing the kidney dysfunction, you may be diagnosed with conditions like diabetic nephropathy, polycystic kidney disease, hypertensive nephrosclerosis, and when we use the term CKD, it applies to all of these conditions.
Application in nursing. The goal is to keep blood pressure at heart below 138 mmHg. Making that change can help protect the kidney and prevent heart disease as a strong shotwash. Do not smoke helps meet the heart load in fat and cholesterol. Pros and cons. Pros: injury to the kidney stone and infection, problem with the arteries feeding the kidney. Cons: angiotensin converting enzyme ACI inhibitor or angiotensin receptor blocker are used most often.
Hi, I'm Cindy with the DeVita Learning Center. In this video, we'll learn about some of the symptoms of chronic kidney disease. While the symptoms can be subtle, knowing what they are can help people detect kidney disease so they can receive early treatment. Because the kidneys are located in the lower back, pain in this area is one sign of kidney disease. Keep in mind, this symptom can also be confused with muscle pain. Usually, the symptoms of kidney failure become apparent due to changes in urination or accumulation of waste products in the body. Symptoms of kidney failure that can be observed due to changes in urination can include making more or less urine than usual, making urine that is foamy or bubbly, feeling excess pressure when urinating, changes in the overall color and appearance of the urine, and blood in the urine, which is usually only detected through a microscope. As the kidney loses the ability to make urine, fluid builds up in the body. Symptoms of fluid buildup are sometimes confused with asthma or heart failure. Other symptoms can include swelling in the face, feet, or hands, and shortness of breath, usually due to the fluid in the lungs. Other symptoms of kidney disease may be the result of a buildup of waste, metallic taste in the mouth, or ammonia breath, nausea and vomiting, loss of appetite, not wanting to eat meat or other strong flavors, difficulty concentrating, feeling itchy, and feeling fatigued. Being tired is a symptom of kidney disease that can be the result of being anemic. When kidneys are damaged, they are no longer able to make a hormone that helps the body make red blood cells. Because of this, enough oxygen doesn't get to all the cells in the body, resulting in anemia, which causes tiredness and weakness. If you have any of these symptoms and suspect it could be kidney disease, it is highly recommended that you see your doctor for a kidney checkup. When it
issue applied in Ecuador. Since this meeting, a committee has the white model original how that can be combined with the disease surveillance and prevention algorithm function. In some countries, the committee has established official come with two countries, Chile, Argentina, Uruguay, Venezuela, Colombia, Brazil, Paraguay, Bolivia, Mexico, Puerto Rico, Peru, and Ecuador.
There are many complications of chronic kidney disease, and most of them you would see in patients ongoing with their hemodialysis. One of them could be anemia, another is renal bone disease, and most commonly also is heart diseases.
Conclusion. There is no correlation between the degree of azotemia and the pressure of nerve bed that is occupied. The Broadway vein is thought to result from chronic anemia and the broad vein from increased melan deposition, a distinct possibly from an increased concentration of the melanocyte stimulating hormone.
Learning medicine is hard work. Osmosis makes it easy. It takes your lectures and notes to create a personalized study plan with exclusive videos, practice questions, and flashcards, and so much more. Try it free today. Chronic kidney disease is a broad term that includes subtle decreases in kidney function that develop over a minimum of 3 months. In contrast, acute kidney injury refers to any decrease in kidney function that happens in less than 3 months. Now, the kidney's job is to regulate what's in the blood, so they might remove waste or make sure electrolyte levels are steady or regulate the overall amount of water. And they even make hormones. The bottom line is that the kidneys do a ton of stuff. Blood gets into the kidney through the renal artery, and once inside, it goes to tiny clumps of arterioles called glomeruli, where it's initially filtered. And the filtrate, which is the stuff that gets filtered out, moves into the renal tubule. The rate at which this filtration process takes place is known as the glomerular filtration rate, or GFR. In a normal, healthy person, this is somewhere around 100 to 120 milliliters of fluid filtered per minute per 1.73 meters squared of body surface area. This value is slightly less in women than men, and it decreases slowly in all of us as we grow older. One of the most common causes of chronic kidney disease is hypertension. In hypertension, the walls of arteries supplying the kidney start to thicken in order to withstand the pressure, and that results in a narrow lumen. A narrow lumen means less blood and oxygen gets delivered to the kidney, which leads to ischemic injury to the nephrons glomerulus. Immune cells like macrophages and fat-laden macrophages, called foam cells, slip into the damaged glomerulus and start secreting growth factors like transforming growth factor beta 1, or TGF beta 1. These growth factors cause the mesangial cells to regress back to their more immature stem cell state known as mesangioblasts.